Lesson 5. Squeeze issues. During a dive, squeezes occur when a diver's airspace cannot equalize with the ambient pressure as described above. Squeezes due to ambient pressure in tissues are also called descent barotraumas. Perhaps the most common squeeze is the air squeezes in the middle ear, also known as air barotrauma. The eardrum separates the other ear from the middle ear. The eardrum is elastic and highly sensitive to pressure changes. When a diver cannot equalize their ears, they create an imbalance between ambient pressure and internal pressure. This leads to squeezing. The middle ear opens to the mouth through the eustachian tube, but the parts of these channels opening into the mouth are normally closed. If a diver uses any of the ear equalization techniques to open these channels, equalization occurs in the middle ear. Some ear equalization techniques. Valsalva technique. Antonio Valsalva was aware of the workings of the middle ear and developed the first known middle ear equalization technique. In this technique, the nostrils and mouth are closed, the jaw is kept tense, and pressure is forced out similarly to exhaling through the nose without letting air space. Thus, air is sent to the middle ear. This technique is easy for all divers, especially for diving candidates to apply. Phrasal technique. Closing the mouth and nose and contracting the muscles at the base of the mouth to send air from the throat to the middle ear through the eustachian tube. It is used to complete the missing middle ear pressure. Advanced technique. Pushing the lower jaw forward while performing Valsalva or phrasal maneuvers. It enhances the effect of the maneuvers. Toynbee technique. Swallowing with the mouth and nose closed. It reduces excessive middle ear pressure. Divers often use the Valsalva maneuver. However, this technique is strenuous. The best technique for descent is the phrasal maneuver or the advanced technique. If we delay or struggle to equalize our ears during descent, we should ascend a meter or two and try equalizing again. If we try to equalize forcefully as depth increases, we can cause serious ear barotraumas. Even if we ascend appropriately and still can't equalize, the dive should be terminated. Possible issues should be discussed with the instructor until the next dive, and if deemed necessary, a specialist doctor should be consulted. Sinuses are small air space in the skull. Sinus squeezes occur due to blockages at points connected to the throat. Equalizing sinus tissues does not require effort. They are already open circulation and adapt to pressure changes as long as they are healthy. If there is an illness like a cold in the upper respiratory tract, these channels will likely close. In such a case, sinus squeezes are inevitable during the dive. The sinus enable to equalize their internal airspace with external pressure, squeeze, vacuum effect, and experience tissue trauma or trauma. The diver feels severe pain, especially around the forehead and facial area. Sinuses are located near forehead and cheekbones. If a diver experiences severe pain, especially in the forehead area, they are likely experiencing sinus squeeze, sinus barotrauma. In addition to the ears and sinuses, squeezes can also occur in the mask's internal airspace and extra airspace that divers have. If a diver cannot send air to this space due to an increase in ambient pressure, an imbalance occurs between the external environment and the mask's internal pressure, resulting in a squeeze. Mask squeeze can also indirectly cause tissue trauma. As the mask tanks, it begins to pull the surrounding facial tissues inward. To prevent mask squeeze, sending a small amount of air into the mask through the nose after performing the ear equalization movement during the dive will be sufficient. Another problem is holding one's breath underwater. If a diver holds their breath during ascent, pressure cannot be equalized. The expanding air can enter the circulatory system from the lungs, reaching the brain and potentially causing irreversible damage.